Health Secretary Wes Streeting is here to join us today.
Good morning. Happy New Year.
Happy New Year. So overnight, Donald Trump has doubled down on his threat to take over Greenland, which is currently, of course, part of Denmark. He told NBC News, "We need Greenland for national security. We need it for national security right now." What's your response?
Well, and the UK and NATO members are doubling down on support for Greenland, their right to self-determination, their place as part of the Kingdom of Denmark, and the role that they are already playing as part of the NATO alliance. The good news for President Trump is that Greenland is already part of the team and is playing its part in defending our national security as the UK and our collective security.
Because, you say there about playing its part for the team, because this is the implication of what Donald Trump is saying, suggesting that actually the US having control of Greenland would benefit Europe. We need Greenland for national security, and that includes Europe. So that's a load of rubbish then, is it?
That's not, I think, a fair characterisation of either the European collective security interest or where either the European Union or the United Kingdom and other European countries that are not part of the EU stand. We're really clear about that.
We've heard from the Danish Prime Minister, who said that if the US invades Greenland, everything stops, including NATO. Do you agree? Would that effectively lead to, the collapse of NATO?
At a time when we can see the security of NATO members and the alliance at threat, particularly from Russia, but also from our other adversaries, this is not the time to destabilise NATO and to undermine our collective security.
Is that what Donald Trump's doing?
We're really clear about where we stand. We're really clear with the United States about where we stand on Greenland. And what you've seen from the Prime Minister and the Foreign Secretary, not just in relation to the fast-moving events in Venezuela, but more generally when it comes to our relationship with the United States and actually diplomacy and foreign policy more generally, the Prime Minister chooses what to say, how to say it, and when to say it, very carefully. And what he always has at the forefront of his mind is how does he make sure that he uses his influence and leverage in a way that first and foremost works to our national interest, whether economic interest or security interest, and then for the collective interest as well of global security and the rules-based system which we've seen disintegrating before our eyes.
Just reading between the lines of what you're saying there, we've got, of course, that really important meeting on Ukraine, which the US is a big part of. Europe needs the US, let's be honest. Is this partly why you've got to be so careful when it comes to criticising him on Greenland, on Venezuela?
Well, this is just the nature of diplomacy. And look, there are some countries, indeed there are some colleagues who are out stridently criticising the United States and their action. The UK has a different relationship and the Prime Minister has unique leverage and influence. And he sought to bring that to bear consistently and I would argue effectively to pursue our interests.
In what sort of way? Because he hasn't done what we wanted on Ukraine. He's gone into Venezuela. He's threatened Greenland. Where is this unique leverage?
Well, hang on a second. Firstly, when it comes to trade and the UK's economic interests, we've secured trading terms with the United States
that are worse than where they were before Brexit.
Sure, I don't dispute that, but better than anyone else has managed to achieve. And secondly, when President Trump came into his second term, there were real question marks about where he would be on Ukraine, on NATO, and the Prime Minister has built a strong relationship to leverage the United States' involvement in Ukraine and NATO and European defence and security. And what the Prime Minister has sought to do is to perform what actually has been the historic responsibility of British Prime Ministers, which is when there have been divides between the United States and Europe to attempt to bridge those divides. And that's what the Prime Minister's been doing against a very challenging global backdrop, but he's been doing it successfully.
Has Donald Trump broken international law when it comes to Venezuela?
I've got nothing to add to that than the Prime Minister and the Foreign Secretary has already said. And as I say, and I appreciate that there are colleagues in Parliament, I followed the exchanges yesterday, who've been very strident in their criticism. I understand and respect that. What the Prime Minister and the Foreign Secretary are doing is choosing their words carefully and choosing their timing carefully because they're trying to influence the situation. That's the nature of diplomacy, Sophie. I'm not here to be a commentator, and the Prime Minister and the Foreign Secretary are not commentators either.
If you were in Cabinet, it's fair to say you'd be taking a bit of a different line, right? I mean, I remember the time, in 2017, you called Donald Trump an odious, sad little man. Is that what you think that he's like now? If you're looking at what he's doing in Venezuela,
I am in the cabinet, and I'm part of the team, and I'm not going to make comments that make the job of the Prime Minister or the Foreign Secretary any harder than they are against the backdrop of what is a fast-moving and turbulent situation. What I can say is, obviously, a number of us in government have criticised President Trump in the past, and both President Trump and the Prime Minister have been very clear. They are not natural political allies. They don't come from the same political tradition. They have very different styles and very different characters. But the Prime Minister has worked through all of that with President Trump to build a relationship.
I'm keen to talk about...
to try and leverage that relationship in our national interest. And I think the Prime Minister's done that very successfully.
I'm hurrying because I want to talk about the health story as well, because you've got an important story today about online services. Well, what's the plan there?
So, Prime Minister announced NHS Online, which is a new online hospital service that will get people faster access to specialist care by making sure that where it's clinically appropriate and safe to do so, if you've seen a GP, you need to be referred to a specialist. If you can see that specialist initially online to review your case, look at your symptoms, and then decide the next course of action, and that gets you seen faster, we will do that.
I was interested to see some of the conditions, so menopause, endometriosis, by kind of bypassing GPs and going to specialists. Is that a bit of a recognition that sometimes GPs are just not taking these conditions seriously enough?
Well, I think they're two separate issues. It is definitely the case, particularly in women's health, that when it comes to particularly conditions like endometriosis or menopause, women have not always been getting the service that they deserve from their GP. And we're taking steps to address that through training and faster access to specialist care, sure. But there will also be, GPs by their nature are general practitioners for a wide range of conditions. They will often need to refer someone to a specialist. And when they do, if you can see that specialist faster online, and then that specialist online says, might say to you or I, actually, you need to go for a diagnostic test and scan, well, you'll be able to do that at your local hospital or diagnostic centre, but crucially, you'll have reached that stage faster. It may be the specialist says, OK, no need for any surgical procedure, but you do need a prescription. Well, that will pop up in your app. You'll be able to collect that locally. And the idea is that you'll be seen faster. We'll get an extra 8 million appointments through this route. About, a large proportion of the current NHS waiting list is around the sorts of specialisms and the sorts of conditions that we have available to treat through NHS Online. So this will make a real difference. And by the way, for anyone watching who's thinking, well, the last thing I want to do is talk to someone through a screen. I'd like face-to-face, thank you very much. What's he talking about? Well, the good news is, if I've chosen to see that specialist online rather than through my local hospital trust, chances are I've gotten out of the way of the queue for someone who would prefer to see someone face-to-face locally. So everyone benefits from this. Can
I finally ask you about this puberty blocker trial that's going ahead at King's College Hospital in London? It's expected to start this month in January, and it's involving 226 young people, all under 16, who are going to be given these puberty blocking drugs because they're questioning their gender. Now, some MPs are really, really worried about this, right? They say that it's immoral. They say it's a shameful experiment on children. Are you comfortable with, kids, perhaps as young as 10, being given these very powerful drugs that could stop them going through puberty?
Comfortable, no. What I've had to weigh up in this is how do we make sure that for a particularly vulnerable group of children and young people, they're getting access to high-quality care, and crucially, we're mitigating against risk of harm. I've followed expert advice. People may remember Hilary Cass, one of the country's leading paediatricians, was actually commissioned by the Conservatives to look at this issue. She published the Cass report into Gender Identity Services, and she set out a range of recommendations, and I'm following those recommendations.
They're very young kids, though, aren't they?
They are.
And these are very strong drugs.
And I've met lots of children, young people who've actually been extremely angry with me in a different direction on this. People may remember when I came into government, I upheld the temporary ban that was put in place by my Conservative predecessor. I turned that into a permanent ban and made it clear that there was not the evidence to assure me that there was a safe prescribing environment and that the drugs were proven for this particular case. These sorts of drugs are given to young people, actually, but for conditions like precocious puberty, which is a different condition. So I've sought to proceed in an evidence-based way following expert clinical advice. I've tried to take the politics out of what has been an extremely difficult and sensitive issue. I think there are still big questions about how we ever ended up in this situation where these sorts of drugs were being routinely prescribed, and we're continuing to get into that and looking, because there'll be another study looking at what's happened to that cohort of young people over time. The thing I've had to continually weigh up is that for lots of people who have been through this sort of gender identity treatment, they describe this as life-affirming and life-saving, but there is an understandable degree of public anxiety and concern. The crucial reassurance is that not just anyone will be able to sign up to this trial. They will go through extensive assessment by expert clinicians locally. That will be reviewed nationally, and every young person would need to assent. They're not old enough to consent. They would need to assent, and they would need the consent of parents. And so there are lots of checks, balances, oversights and safeguards and constant monitoring in a way that disgracefully wasn't there before. That's what gives me the confidence and assurance of knowing this trial is safe. There is a debate about whether...
the trial's safe, you would say?
Yeah, there is a debate about whether this is the right thing to do. I understand that. And there's one thing we've learned about this particular area of policy is that we shouldn't silence debate, dissent, disagreement. So we'll continue to have that, and we'll continue to be subject to scrutiny and challenge.
OK, Wes Streeting, thank you very much indeed. Wes Streeting there, the Health Secretary.